There was a time not all that long ago that suicides among veterans of the Gulf War were a dirty little secret that no one liked to talk about. I remember as a reporter covering a rash of veteran suicides in another state, no one seemed to know what to do, most especially the VA. Today, an estimated 20 veterans commit suicide every day, but now the Veterans Administration is engaged in an aggressive program. It is called Reach Vet. It is designed to identify vets at risk for suicide and mental illness and provide preemptive care and support. And joining us for more on veteran suicide prevention is Jerry Zivic, a government benefits consultant and consumer watchdog, Brian Jacobs, a Navy veteran and founder of the local organization Vets to Chefs, and Patricia Frederick, a suicide prevention coordinator at Bay Pines VA Healthcare System. Thank you all for joining us. And Brian, let me start with you, because I remember talking to Vietnam veterans who said back in the day when they left the service, the military shook their hand and said good luck, goodbye, and that's all they got. When you came out of the service, was it different? And how many vets do you know out there who really kind of need help that most people don't really understand?
You know, when I got out, it was unique. I had just recently gotten back from a combat zone, actually, from Iraq. I was in the Anbar province in 2005, and we had just, kind of done a quick change of command, and I was actually on my way back for orders. And I basically had a choice to make. I could get back, and within 7 days I would be out of the Marine Corps, or I would go back. And so you had 7 days to transition direct from a combat zone. And this was kind of a situation of if you're in, you're in. If you're out, goodbye. And unfortunately, it's a tough process. I mean, TAPS, the Transitional Assistance Program, it does wonders for what it does. It does give you some insight, but there's, if you think about the military, they take so much time to develop a Marine or develop a sailor or a soldier. I mean, boot camps are, 10 to 12 weeks long. But there's not that same emphasis put on getting out.
It's like a screeching stop,
right,
from 0 to 60. Patricia, I mean, we have a lot to discuss, but is there a newer realization at the VA that that's what's happening to vets, and that there has to be more awareness that as soon as men and women come out of the service, they need at least some kind of screening or help?
Yes. I think the VA would like for those who are leaving service to come to the VA as soon as possible, enroll, begin to see what services you're interested in being a part of, so that in the future, if you decide you've started off with just medical care and then you see that something's going on in your life and it needs treatment, it's very easy to just transition right into mental health care.
Jerry, from the veterans' point of view, do veterans, I don't want to say have a responsibility to figure out what services that they're going to need or what are out there? I mean, do the majority of veterans just don't know? Does the VA, in terms of a consumer level, do a good enough job to let vets know they're there for them?
I think there's a mutual responsibility on the part of the VA and on the part of the vet to meet with each other and talk with each other. I've read studies that have said the first 4 weeks after you're discharged are the most crucial weeks for a veteran. And I think the VA has recognized this now more, and they're reaching out more. But I don't think they were very good at finding vets that wanted to be lost. But as Brian, actually, we were talking before, if a vet wants to hide, you can't find them. You have to make yourself available to be found.
Okay. We are just getting started with this really important conversation, and we will pick it up right after we check on the weather. Welcome back. If you're just joining us, we are discussing the rate of veteran suicide and what is being done locally to respond to the crisis. Our guests tonight are Jerry Zivic, a government benefits consultant and consumer watchdog, Brian Jacobs, a Navy veteran and founder of Vets to Chefs. We want to ask him about that in a few minutes. And Patricia Frederick, the suicide prevention coordinator at Bay Pines VA Healthcare System. And Patricia, I wanted to start with you because during the break, I talked about the travel the VA has been in terms of recognizing this as an important issue. And you say over the last 10 years, the VA has really learned and grown in terms of how it handles veterans and mental health issues.
Absolutely. The VA has put in place programs that are designed to really reach out to the veterans and really help them to get access to care. And all staff are trained to look for signs and signals of suicide risk. And all of the providers are doing screening, risk assessment, safety planning with the veterans so that there's a better chance the veteran has the tools to know how to help themselves.
Is funding adequate?
I really can't speak to that, but I certainly do wish that we had more staff available.
Congressman, if you're listening, tomorrow night you're holding a town hall.
Yes.
What's the purpose?
The purpose of the town hall is to bring in the community and veterans to tell us what they're thinking, how can we all work better together to help to address issues related to suicide. We all know that this is a critical issue in our country as well as with veterans, and the VA is very clear that one suicide is too many, and we want to know how can we work with the community to help solve this.
Of course, the VA and what it does is only one part
Correct.
of this issue here. And Brian, you run an organization that is called Vets to Chefs. What is that?
Vets to Chef it's all about giving passion and purpose to a veteran's life through food and brew, as I say. As I tell most people, food found me when I decided that I needed a place in this world. I had gone through so many jobs. I had gone through actually 22 jobs. I sold insurance, I mowed lawns, I was selling air conditioners in a place that you really didn't need air conditioning. I mean, I was doing anything to make a dollar. And I had just latched on to something that had really found me in my darkest times, and that was food. And food brings people together. Food gives you an opportunity to be creative, to be artistic, to be insightful, to be passionate, and you can never stop learning about it. And it's something to me that has kind of really resonated deep from, going even back overseas. Is the best times of your life was sitting down, even opening an MRE bag with your brother Marines. I mean, it was something, it could be Christmas, New Year's, you didn't care, you were just happy to be able to break bread.
It almost seems like what you're saying is cathartic.
Yes.
Jerry, what as a community are we doing to make it easier for veterans to find the services that they need? I mean, you're a great consumer watchdog, but there's not a Jerry Civic on every corner.
Well, I think a show like this is very helpful. I think reaching out to friends and saying, hey, watch this show on suicide prevention and tell a friend about this. I think that is really critical. I think we all owe a debt to veterans. The sacrifice they made, the risk they made, and we as citizens have to look out for our vets every day, and it's critical to us. We have to be aware that there's a crisis hotline number. We have to be aware that there's a crisis text number. We have to be aware you can go online and have a chat with somebody, because if we see somebody that's struggling, we should reach out and help them.
The thought occurs to me is, Bay Pines is an incredible facility, and from what I understand, you're opening a new mental health center up there that is going to be the state of the art. It's unbelievable, and that's all well and fine if you're a veteran in need of help in the Tampa Bay area. But we have a huge state here, a rural state, and a lot of veterans live in it. And Brian, you have firsthand experience of what happens in terms of a vet who lives maybe not out in the middle of nowhere, but close to it, and doesn't have this kind of facility right near them.
Well, it is, and it's one of those things that's, I look at the care I get from the VA here, and it really is wonderful. I mean, I get taken care of. I can call the VA hotline when I need, and I can go to an appointment immediately. But when you live in an area such as my younger brother did, in the middle of nowhere in Georgia, when it was middle of nowhere, it was a dirt road. It was far. It was off the beaten path. It was his way of dealing with life. And you sit in your thoughts, and you sit in your mind. And at this point in his life, he decided that his life was no more of value. And we lost him 3 years ago on Memorial Day weekend. And it's, it's one of the big factors of starting Vet the Chef is, I couldn't reach him. I couldn't reach out to him the way I wanted to make an impact in his life. And I am going to make that difference now. I'm going, the great thing is that we have a great community here that's making that impact. The new programs, but it's about putting the word out and have the community sponsor, get involved in programs.
Patricia, what can the VA do? I mean, what you're doing here in our area is fantastic, but there is a nationwide debate over how to handle veterans who do not live this close to major VA centers.
But there's also a nationwide network of suicide prevention teams in every single VA who are responsible for all of the smaller clinics, that are affiliated with VAs as well. So the coordination among suicide prevention providers throughout the country, it goes on every day.
And I could address this to all of you, but I know from my years of reporting on veterans issues, what you were saying about your brother is not dissimilar to what a lot of Vietnam veterans here in Florida experience, that some of them actually lived in the middle of the Everglades because it reminded them of Vietnam, but it was because of the PTSD. And is that part of the equation that our system is able to deal with?
I think, and I'm sure Patricia will agree with this, it's not just the PTSD, it's called polytrauma, where you have the PTSD, you have the substance abuse, and you have the depression. Those three factors, when brought together, that's the biggest cause of suicide with veterans. But I do want to address something, and not to be a naysayer here, but the VA is working really hard, and since the last quarter of 2016, I feel that it's really worked really hard. But just because Brian's brother lived off the grids, there's no excuse wherever any veteran lives in the United States that they should get second-class treatment. And that's actually one of the problems with the crisis hotline. They had the one crisis center in New York, so they expanded it to Atlanta. But while they were expanding it, they didn't have enough staff in New York. So there's been a study that when callers would call in on crisis, they would go to a secondary holding center and get a busy signal, and they weren't treated correctly. And there's no reason that there should ever be second-class treatment.
What's the answer to that? Plus the fact, when these issues are talked about in Congress, I often hear members of Congress say, well, the answer to that is to allow veterans to get private health care that's paid for by the government. Is that the answer, Patricia?
I think when the VA can offer evidence-based treatment that has been researched and analyzed and is designed to be effective, and that's really invaluable, and you can't always find that in the community.
Wow. Let's take a quick break, and when we return, we'll have final thoughts from our guests, plus what some of our viewers are saying about last night's topic, local tax dollars funding charter schools. Time for final thoughts, and we were talking before the break about the issue of, it's great to have Bay Pines around here and all the services that are available, but what do you do when vets live in more rural areas and are too far away to travel to the VA? Some members of Congress, Jerry, are saying that veterans who live in rural areas should have access to private physicians. But does that have an impact in terms of suicide?
Absolutely. There's been a study that shows that there's been an 8% increase in suicide for veterans that have been treated at the VA. However, for veterans that have not been treated at the VA, it's almost a 33% increase in suicides. So if you want empirical data that you need to go to the VA, there it is.
Patricia, with the end of the war in Iraq and Afghanistan, there are so many more veterans, new veterans, coming into the system. Is the VA at Bay Pines able to accommodate them? I know you're building and building up there, but are you?
We think we are. We would like the veteran to come and to begin to get engaged in care. Yes, we feel we're ready to receive the veterans.
And Brian, what can you say again to the people here in the Sarasota community? There are so many veterans in our community here, retired vets and new vets coming in. Your program is incredible, but is there enough programs like that around here?
There isn't. And, this is something that we, myself and a lot of the great sponsorship here in the local veteran community have thought about is that, how do you impact more? How do you make a bigger impact? And it's, it needs to be really looked at as more of a reintegration. And it's wonderful what the VA is doing. It's wonderful what these organizations are doing. But what's the next steps? What's the follow-through on the care? That's kind of where I feel like a lot of the shortcomings are, is that we treat veterans, we give them opportunity, we find ways for them to deal with it, but this is long-term care. I love going out to a good event where I love seeing my doctor, but if I had nothing really to positively put my mind into and search for every day and use for better, then where am I really gone? What have I really treated when I go home and sit? And it's going through organizations like reintegration programs like Vet to Chef and the other programs that we're supporting, like Vet to Brew, the Vet to Agro, the Vet to Bees, giving passion and purpose through something you can find a love for, to find a love back into this world. And that's where the VA and the other local community sponsors need to come together, is find those next steps of treatment.
All right, we'll have to leave it there. Thank you all for being here tonight. Before we go, we want to share with you what some of our viewers are saying about last night's topic, funding charter schools. Under a new sweeping education bill signed into law by Governor Rick Scott, school districts across Florida are required to give around 7% of local tax dollars to charter schools. Proponents say these schools deserve funding, while opponents say it will hurt the quality of public schools. And here's what some of you are saying. Michael Eliason writes, the legislature seems to find things to do with our tax dollars that we didn't ask for and refuses to do the things we voted for. Why are they called representatives? Doreen Starkey writes, when did we vote on this? Don't think the taxpayers get to vote on hardly anything anymore. But Rihanna Madison writes, I think it's fair that the money is shifted a bit. Think about it, charter schools, parents pay taxes too. Charter schools are public schools. Well, what do you think about the rate of veteran suicides? What more can be done for our servicemen and women who are in need of mental health care? Join tonight's conversation by visiting our Facebook page at facebook.com/news@7. And FYI, you can watch past discussions. They're available on demand. They're available on Apple TV, Amazon Fire, and Roku. Thanks to all our guests for being here tonight. Jerry Zivick is a government benefits consultant and consumer watchdog. Brian Jacobs is a Navy veteran and founder of the local organization Vets to Chefs. And Patricia Frederick is the suicide prevention coordinator at the Bay Pines VA Healthcare System.